Hi, my name is Nick Hartog. I'm here to do a Foley catheter on the female. When I first walk in, first thing I'm gonna do is check the charts and make sure this is the proper procedure. Then I'm going to gather all my supplies, which I have done already. Then I'm going to introduce myself and then also check the patient for the name and date of birth. I'm gonna ask for any allergies, especially if they're allergic to iodine. Then the next thing we're gonna do is I'm gonna close the curtains for privacy, check the lighting, shut the door, raise the bed, and then we're about to get started. So the first thing I'm gonna do is I'm gonna put on the proper PPE and do my hand hygiene. Then the next thing I'm gonna do is I'm gonna put on a pair of clean gloves to start off. And next thing I want to do is I'm going to take the towel, pull the towel back. When I cover the patient, so the only thing I'm exposing, only have to expose what I have to. Roll it back usually about to the feet. The next thing I'm going to do is I'm going to start off, I'm going to place it. Oh, well, before I do this, I want to put on the absorbing pad first, so I don't get anything wet. Tell the patient to lift up if they can. And now I'm going to start to clean the patient. So there's just going to be some water in here. I'm going to, this will be slipped back a little bit more. Now I'm going to take my non-dominant hand, place it and do and spread it. Spread the labia a little bit and take the water. I'm going to dab down on the far side, then put it back in the water, and then dab down on the closer side. Put in some water and then dab down one more time down the middle. Okay. And now be done with that. I'm going to take my gloves off. Throw those in the garbage. Perform hand hygiene again, and now we're going to start the sterile station. So we'll just set this off to the side. So I'm going to first grab my sterile gloves. Tips. And then the second one is going to be, these gloves are a little messed up. You would put fingers inside the cuff. Okay. So now I'm going to use drapes. Set up sterile field in the bed and have the shiny side down. And here's the first. Now when I'm doing this, I would not touch the patient's legs. It's a little difficult when the patient doesn't have any legs. You basically grip this, pull it up, and try to slide it as close as possible without touching the patient, which I just did. But then you could put this one on over the vagina, but I'm not going to use this one. So I'm gonna just start off by now putting okay. So I'm going to take the cap off. I'm gonna get rid of the iodine. We're gonna open the hydrogen peroxide and put it on the cotton balls. Then we're going to take the lubricant gel and put some in the middle. The next, we're going to take the tube and we are going to take off the sleeve by rolling it each side. Discard this. I will place the end into the lubricant gel, again without touching the leg of the patient. Take the syringe, stick it in. Okay, now, so let's do it on this side here. And this can only touch the sterile field. Now, the first thing I want to do is take my non-dominant hand and spread. Let's just tuck it under. I'm going to take tweezers and the cotton balls, and we're going to do, this would be spread as far as you can. I'm going to do the outside first. One swipe, throw away. Second swipe, down, throw away. Third swipe, down the middle, toss it. Don't need the pliers anymore. Now the next thing we're going to be doing, we're going to insert the catheter. Let the patient know there's going to be some pressure, but it should be over fairly quickly. So we would find the urethra, stick it in. Try not to be too forceful. Where you're gonna stick it in all the way until a little bit of urine comes out, and then stop. Now you're going to insert the saline into the balloon now that it's in the bladder. All the way down. Going to disconnect. Put it on the side. Then I'm going to double check to make sure that it's in properly until just waiting for a little bit of resistance. And then now we've done by the procedure, but you would then take the strap and we would strap this to the leg. And then I would also, after this is strapped to the leg, this would be down on the bed, the side of the bed. Okay. And I would clean up the mess. Get rid of all this and cover the patient back up. Now, we also have to take it out. So the procedure to take it out is we lay out some drapes down. Then we are going to for that. Before we start this, before we take it out, I will perform my hand hygiene. I'll put on a new pair of clean gloves, and now we're ready to take it out. So I'd start off by sticking the needles back in, deflating the balloon. Let's see.
I also want to mention that I have a fabric bag right there, just to make everything a little bit easier for me and make the procedure a little bit quicker. So like I said earlier, this patient mentioned that she's allergic to iodine. So I'm just going to dispose of that right away. And what I want to do is I want to take the other option, carbon monoxide, and spray a little bit on the wall.
Okay, and now I'm going to let the patient know that there's going to be a little bit of a burn and a little bit of pressure, but it should be over pretty quickly. I'm going to pull it as quickly as I can and roll it as I'm pulling it out. I'm going to take my bag, and as long as there's no urine in here, we can discard this entire thing into the biohazards. And that will be all for the female catheter.